Medical Watch, teen mental health. It's a crisis that's not improving. The CDC just released some troubling youth risk behavior survey results. Today, we take a closer look at the results and, more importantly, what we all can do to help children in crisis. Dr. Sonia Sandhu, psychiatry specialist in Chicago and in the suburbs, joins us now to dissect the new Centers for Disease Control report and offer advice. Thank you for being here.
Thank you. Good afternoon, Dina. Thank you for having me on.
So this was not just adults talking about how they think teenagers feel. These cries came from a teen survey. They're sad, they feel suicidal, they face sexual violence. What is going on?
You know, I think it poses a very unique and interesting question. A large component of what mental health providers all across the country have been feeling over the past couple of years is this burden from the mental health perspective of teenagers. A large component of that can definitely be attributed to the COVID-19 pandemic. I think that hybrid and e-learning really had an impact on the social, emotional, and educational development of our youth. So I think that burden actually came at a very critical time for a lot of teenagers.
Clearly, the isolation of pandemic impacted the survey results because it was taken in 2021, but have things improved at all?
Yes, I do believe so. And I think a really large component of that improvement has been the efforts from school districts, pediatricians, therapists in the community, being able to identify key features of early signs of depression and anxiety in our youth, and maybe being able to connect them to resources in the community to get the help that they need.
I know in my daughter's high school, they have really put a big focus on this, but still the numbers are staggering. You know, there's always been this sense of teenage angst, but how different is this? Can you put it in perspective for us?
Definitely. I think a large component of that could be attributed to social media use. Some numbers just recently came out that 70% of 13 to 17-year-olds check social media several times a day. 16% of teenagers have actually reported checking it constantly throughout the day. This is something that mental health providers are taking a very close look at to see exactly what the correlation between them are. But I think you can definitely attribute higher amounts of cyberbullying and sexual exploitation by other teenagers to kind of contribute to this mental health burden that we're seeing.
Let's keep talking about those statistics, and more specifically boys versus girls, because 60% of the teenage girls said that they felt this persistent sadness. That's double the rate for boys. Why such a big gap?
I think it goes back to how different females and males can present with signs of depression. Girls tend to be a little bit more internalizing with their symptoms. They keep them to themselves. They might internalize and have trouble verbalizing exactly what it is that's going on. And that also leads to difficulty with them being identified with symptoms of depression or sadness. Males, on the other hand, sometimes have a tendency to be a little bit more externalizing with their symptoms. They can be a little bit more behaviorally challenged in other situations, or be challenging, can be sometimes labeled as bad behavior. Even though that is very different, I think that because of how outward they present themselves, that could be easily more picked up on by teachers, parents, and school officials, and get them help that they need a little bit more quickly than female.
Yeah, the help is so important. Let's talk about the biggest risk here, and that is suicide. What are the warning signs, and how do we begin the conversation?
The biggest risk factor for suicide would be prior suicidal gestures or prior attempts. That is probably the most predictive factor for children going forward. Signs and symptoms of depression are also very important to look for in a child. That would be persistent sadness, as the survey pointed out, anhedonia, not being able to enjoy things that you enjoy doing, having difficulty with sleep and appetite, changes in those behaviors, social isolation, having difficulty with school performance and concentration. Those are all signs of a possible underlying depression, and I think it would be important to identify those in children that are at risk.
Yeah, it's critical to talk about. Thank you so much, Dr. Sonia Sandhu. And for you at home, we'll have a link to that CDC report post on our website at WGNTV.com. Ben Lourdes.
Thank you, Dina.